To perform the serratus punch in the supine position, lie down on your back and place your shoulder in about 90 degrees of flexion. Keeping your elbow in extension, punch upwards towards the ceiling, lifting your shoulder and arm at the same time, and slowly come back down.
Scap push-ups on the table are a progression from the serratus punches. The body part is the shoulder. The muscle being worked is the serratus anterior. Patient position includes standing and leaning forward with their hands on the table and their body linear. The plane of motion is the sagittal plane. This is a closed kinetic chain exercise. Some common cues will be keep your body in line, keep your arms straight, and focus on pushing your back out at the top. A patient can perform 3 to 4 sets of 10 of this exercise, and the concentric motion is protracting the scapula at the peak of the push-up. The eccentric motion is retracting the scapula as you come down with gravity.
Okay, so this is an open kinetic chain exercise that helps target the middle traps, and the rhomboids, which are responsible for scapular retraction. As you bring your arm into horizontal abduction, that's the concentric motion, and as you bring them back into adduction, that's the eccentric motion. Okay, so I'm not doing it here, which I should be, but you want to hold the duration of the eccentric phase for longer. So you would count to 3 seconds coming down in horizontal adduction to emphasize that eccentric phase, which also helps with strengthening the muscles as well. So the longer the eccentric phase is, the harder the exercise becomes. I would also recommend 3 sets of 10 reps for this exercise with that 3-second eccentric movement. And the athletic trainer can be next to the patient while looking at the posterior trunk of the athlete to follow their bilateral scapular movement. Along with the athletic trainer watching the athlete's scapular movement throughout this exercise, they would also be using those cues throughout each rep to make sure that they are preventing any spinal irritation or injury while doing this exercise. Although this is a transverse plane motion exercise, you want to avoid any rotation of the trunk along with flexion or extension with the head as well. Along with the trunk, this also helps keep the exercise efficient in targeting the muscles that are responsible for scapular retraction. So for this isometric exercise, I want my patient's positioning to be standing feet shoulder width apart. Their arm is going to be extended out into 0 degrees of horizontal abduction. I want their head to be facing forward, and I want them to look forward at all times. I want them to activate their core so that they don't involve any rotational movement, because as you're holding the body blade and doing this motion, it can cause some of that rotational movement in the hips or in the trunk. So I want them to keep their core activated so that they can eliminate that. The athlete can continue this exercise for 30 seconds and do this for 3 rounds. The athletic trainer can stand behind the athlete to make sure that they're not doing any shoulder shrugging, their arm isn't falling down or hiking upward, their contralateral shoulder isn't falling down or hiking upward as well. You want to make sure that their spine is in line. So keeping their head facing forward and looking forward at all times will help with that. And it will help with any rotational movement of the trunk and any flexion or extension of the trunk as well.